Hello, I'm Dr. John Daly, Chief Medical Officer of COLA. Today I'm going to talk about quality assessment. Quality assessment is an active, ongoing, system-wide review process that audits and monitors all aspects of the laboratory's technical and non-technical functions. As part of the process, pre-analytic, analytic, post-analytic, and general laboratory processes are examined, and also any activities which intersect with individuals outside the laboratory, for example, the pharmacy and nursing. At times, setting up a quality assessment program may seem overwhelming, and we question how can we best define and organize the quality studies. First, it is important to consider the components of a quality audit, and listed in this slide are some of these components: the activity to be reviewed, the method of review, the materials needed for the review, the time period included in the sample, the sample size, the expected performance measure, and you want to quantitate this if at all possible, the minimally acceptable score, the date the audit was performed, the audit results, including what problems were identified, how they were resolved, and how they were followed up. In this next slide, I have attempted to give some ideas on prioritizing of quality audits. What's always going wrong or doesn't work properly? What problems are indicated in the laboratory problem log? What complaints have been received? Are there multiple complaints about the same issue? What does the laboratory staff and outside customers find very frustrating with the laboratory? Where are the discrepancies between your written procedures and reality? I have always found it useful to set a quality assessment calendar at the start of the year with the full knowledge that during the course of the year, items can be added or deleted. But a calendar not only assists with quality activities, but can ensure compliance with clear regulations. On this slide, I show you an example of such a calendar. Notice that monthly I have listed quality control, and I do this as a reminder that quality control should be reviewed monthly, but this is more than just reviewing the quality control. This is the audit to determine that the daily, the weekly, and the monthly review of the quality control has occurred, that any abnormalities were followed up, and patients weren't reported when the quality control was not functioning properly. Was the quality control monitored appropriately is what you're looking for. I have listed quarterly proficiency testing 3 times a year. Remember, we have 3 events for proficiency testing over the course of the year. So you want to be certain that all the paperwork is there, that all the exceptions have been evaluated, that anything ungraded has been evaluated, that it has been shared with the employees, and it has been signed off on by the appropriate individuals. Twice a year, I recommend that you look at the calibration of the instruments. Have the instruments been calibrated? This is a very common citation that we see where the instruments need calibration or calibration verification on a set schedule and it has not been performed. So this is your opportunity to find out, are the staff doing the appropriate calibrations on the instrument? Twice a year, I suggest you look at your complaint log, see if the complaints have been resolved, see if there have been any repetition of complaints. Annually, you can look at such things as your informatics with your interface of any laboratory instruments and the IT system to be certain that what is actually coming from the instrument is what's crossing the interface into your IT system. Annually, you should look at your HIPAA compliance, your record retention, your record disposable. And remember, with IQCP, you need to annually have a quality assessment activity to determine if the IQCP that's being performed is actually appropriate. Annually, I advise that you look at reference laboratories. What's the turnaround time? Is there customer satisfaction with it? Are there any things that can be made better and more patient-centric from the reference laboratory? Your personnel records and competency should be reviewed every year. Does the personnel file contain the job description? Does it contain the qualifications for the employment, the appropriate degrees in the file? And importantly, has all the training been done, and is the annual competency assessment present in the file? A safety audit annually and safety training annually. You should do a quality assessment activity to determine that this has been done. And through the course of the year, you will choose pre- and post-analytic activities that you think are important and where you may have had problems, so that you can audit these and see what corrections have been made and can be done to improve the laboratory service and the laboratory safety. I hope you found this informative, and thank you for your attention.